If you're suffering from chronic pain related to scoliosis or hyperkyphosis, and you've already established a baseline level of core strength and stability, this is a great intermediary level core stability exercise program to help you increase spinal stability and decrease back pain. Hi, I'm Dr. Chris Gooble's leading expert and authority in the non-surgical treatment of scoliosis and hyperkyphosis. And I put together this intermediary core stability exercise program, and this is meant for people that have already established a baseline level of core strength and stability, or have already worked through our entry level or beginner level core stability routine for people with scoliosis and hyperkyphosis. But I want you to know this is not a substitute for seeking in-person professional care. So if you've been diagnosed with scoliosis or hyperkyphosis and you've never sought out the expert advice of a healthcare professional that specializes in scoliosis or hyperkyphosis, I do encourage you to get advice from a healthcare professional in person. Now, if you have scoliosis, be sure to click on our link below to download our free guide on treating adult scoliosis. Now, in this video, I'm going to go through a series of exercises that are meant to be done in sequence. The total exercise will take you about 8 or 10 minutes, but when done on a routine basis, I recommend about 3 times a week. These can dramatically increase your core strength and stability and help decrease pain related to scoliosis or hyperkyphosis. We'll begin the intermediate core stabilizing exercise routine for scoliosis with some simple warm-up exercises. The first warm-up exercise we call bent knee out. You're going to lie on the ground with your knees bent. Gradually rotate one knee outward towards the ground, return that leg back to center, then rotate the opposite knee towards the ground, and then bring that back towards center. Repeat this 10 times for each side. The next warm exercise is the knee to chest, lying on your back with your back flat in the ground and your knees bent. Bring one knee towards your chest, return to the ground, then bring your other knee towards your chest and then bring it back towards the ground. Repeat this each side for 10 times. And our final warm-up exercise is called controlled articular rotation, or CARS. You're going to start on your hands and knees. You're gradually going to rotate your pelvis downward. And vertebrae by vertebrae, you want to tilt each vertebrae, going from your tailbone all the way up to your cervical spine. Once you get to your cervical spine, gradually extend your cervical spine and vertebrae by vertebrae go all the way back towards your pelvis. Repeat this 5 times. The first core stabilizing exercise is the dead bug exercise. You're going to have your knees bent and your elbows straight, forming 90-degree angles to the ground. You're going to extend one leg and the opposite arm, holding those straight for about 1 second, then returning your arm and knee to the ground. Then extend the opposite arm and opposite leg. Do this 10 times for each side. We'll then go into the bird dog exercise. Lie on your back with your arms straight and knees bent at 90-degree angles. Extend one leg straight and the opposite arm straight. Return your arm and knee to the upright position, then extend the opposite arm and leg. Repeat this each side 10 times. We'll then move into the mountain climber exercise. With your arms straight and your legs straight, bring one knee towards your chest, return your leg straight, then bring the opposite knee towards your chest. The goal is to maintain a straight line between your shoulders, hips, knees, and toes. Do this repeatedly for 30 seconds. We'll then move into the side plank exercise for 30 seconds. So choose a side, put your arm down, put your weight on your forearm. Put the rest of the weight on the outside of your foot. The goal is to maintain a straight line from your sternum through your pelvis down to your feet. Hold this for 30 seconds. When you're done, switch sides and do a side plank position on the other side. Again, putting your weight on your forearm and keeping a straight line between your sternum, your pelvis, through your knees, and through your feet. Hold this for 30 seconds. Next, we'll do the leg raise exercise. Lie on your back and place your hands under your buttocks. Keep your legs straight and gradually raise your feet up to a 90-degree angle and return your feet towards the ground just before the ground. Repeat this 30 times. We'll then return to the bird dog exercise, and with your knees and hands on the ground, gradually extend one arm and the opposite leg. Return your leg and arm to the mat, and then extend the opposite arm and leg. Repeat this 10 times. We'll then go into the plank position. We're gonna hold this for 1 minute. So put your weight on your forearms, holding your body straight, and you wanna hold a straight line between your shoulders, your hips, your knees, and your feet. Hold this for 60 seconds. We'll then return to the dead bug exercise, lying on your back with your arms straight, and knees bent. Extend one arm on the opposite leg. Repeat this 10 times for each side. For the last exercise, we'll do flutter kicks for 30 seconds. Lie on your back, place your hands under your buttocks. Extend your legs straight. Gradually, do flutter kicks with each leg. Do this for 30 seconds. Now, I hope you found these exercises helpful, and if you know you have scoliosis or hyperkyphosis and you're not sure what to do or what your treatment options are, be sure to click on the link below and request a free discovery call. That'll set you up with a chance to talk to me about your individual case. I can review your scoliosis or hyperkyphosis, I can let you know your risk of curve progression, and most importantly, what your potential treatment options are. Now, once you've gotten these intermediary level exercises down, or if you're currently ready for something more challenging, click on our next video for our advanced core strength and stability exercises designed for people with scoliosis or hyperkyphosis.